Hello everyone, David Wilson here from Dr. Stem Cells. In today's video, we're going to just have a quick look at stem cell therapy and overview. And as we think about stem cell therapy, then the first question is, what is it? Stem cell therapies are any therapies which use either the patient's own, so those are autologous therapy, stem cells, or which use stem cells from another source. Those are called allogenic stem cells. The most common example of allogenic stem cells would be umbilical cord cells, or you might even have heard of people who've received a stem cell transplant if they have cancers like leukemia or lymphomas. In those cases, particularly the cancer cases, you have to make sure that the stem cells are matched to the patient. So you try and find cells that are very close to the patient's own cell type and their own genetics, so that there'll be less chance for rejection. With umbilical cord derived stem cells, that's less of a problem because those cells are almost, you could call them, unprogrammed, and those are cells which are really in the umbilical cord. They haven't quite decided if they're mother cells or baby cells, and because of that you can take them and put them in a third party, and they seem to have a very, very low risk of causing any kind of rejection or reaction. That is not to say that there is no risk, and also it's important to mention that those stem cells have in fact different DNA to the patient's own DNA, so they are not part of the host. Finally, autologous stem cells from your body for your body are stem cells which we would take either from bone marrow or from fatty tissue, generally speaking, to try and centrifuge down and to separate out these stem cells. Often we talk about mesenchymal stem cells or medical signaling cells, MSCs. We can also talk about hematopoietic stem cells, which are from the bone marrow, and those can be cells which are precursors and progenitors to the immune system, your blood components and derivatives. Bone marrow also contains mesenchymal stem cells, so we can see that in those two cases we're actually talking about often the similar cell effect and a similar cell product. Stem cell therapy works by inducing these cells when you put them into a damaged or injured tissue. The hope is that those cells will actually go in, they'll explore the area, and that they will use proteins to try and talk to other cells in the area. When they exchange proteins, the new cells you've injected will actually be able to see that there's damage, there's maybe tissue injury, there's maybe cell death or near death, and they'll be able to interact with those cells and either give the cell a nursing function and instruction set of how to improve itself, or tell the cell that no, you need to go, your time is done, and actually take over that role by replacing the cell. So for example, in a knee joint, if you've cartilage that's worn down over the surface of the bone, you might have an osteochondral defect. Well, stem cells ought to be able to go in there, talk to the cells that are damaged, and maybe even replace them by growing new cartilage. And there's some research which backs that up. Another function of stem cells, apart from that sort of local nursing effect, is also that they can become this new tissue type on their own. And stem cells, given that they can divide indefinitely, mean that if your body needs 1 million cells and you've injected 100,000, well, those 100,000 can divide into 2, into 4, into 8, into 16, and suddenly you have the numbers you need. So stem cells are able to auto-renew and self-renew. They can regenerate their own population, and in so doing, it means this is also a very potential and very powerful source of healing for the body, as long as they have the nutrition and the support system around them. Stem cell therapy has some risks and some challenges. One of the risks would be the same as any other injection technique, where as you inject tissue, you're going to run the risk of causing the patient to have either a little bit of pain, bleeding, bruising, but really the big risk where everyone's worried about would be infection. And this can happen with any injection, joint or subcutaneous, or in any case, even when taking a blood draw for a simple blood test. And that means that this is something we can't ignore, but it's not particularly common. Other challenges then would have to be split into the autologous versus allogenic types. As we look at autologous, that is from your body for your body, it's extremely unlikely, if not almost impossible, for your body to react in a way that rejects the stem cells because they're from your body. It's possible your body will break them down and they won't have effect. However, it's extremely unlikely, if not impossible, as I said, for you to have any kind of graft versus host reaction. When we look at allogenic stem cells, that's also extremely unlikely, but it is possible. There have only been a few reported cases of this in the world, so that's a really good thing. When we're talking about for musculoskeletal or regenerative medical use, there have been more cases of it when it's done in the case of people needing for a lymphoma or leukemia, simply because their entire immune system has been replaced and they can have graft versus host or other undesirable outcomes. Another risk or challenge, I should say, maybe within regenerative medicine is that regenerative medicine, because it's such an emergent and new branch, there isn't the body of evidence we would like. So we're seeing more and more research being done, but a lot of that research is self-funded or self-financed because individuals do not have big pharma backing to do this research. If anything, this is research against big pharma. If you own a company where you can offer patients an option to take a drug every day for the rest of their life to try and manage their pain, and someone comes along and says, but we have this treatment where you can take something from the patient's own body, it's not a drug, and you can inject it in, well, you can see there's a big conflict of interest for pharmaceutical industry here, because they do not want their patients to have options which are non-pharmacological, and they don't want patients to have an option which is essentially a very low cost and hopefully lasting treatment. Now, that's just my opinion. You can tell me what you think down in the comments below, but I do think this reflects a reality, unfortunately, with the world today, that in medicine we've gone away from looking for cures for diseases, and we now talk more about managing patient issues. And that is really because pharmaceutical companies are making their biggest profits from chronic, uncurable diseases. The ethics of that can be discussed in another video. Finally, we'll maybe take a few minutes just to mention a few of the different examples of stem cell therapy. I've already mentioned types of therapy, and we've been talking about that generally earlier in the video, but in my specific example, I do a lot of work with musculoskeletal conditions, and I've done a little bit of work with neurological conditions. Of interest, if we look at stem cells, we have seen a lot of good results with patients who have chronic lower back pain, chronic prolapse, maybe wear and tear osteoarthritis in the hip or the knee, shoulder, and we're seeing people coming in, getting treatments, maybe getting 2 rounds of treatment, and then after a 6 to 12 month period, having a lot of improved function and a lot of improved pain scores, if maybe even in some cases actually becoming pain-free. These are anecdotes, but you do see this reflected in the research as well. On the other hand, I've seen some really good results neurologically with PRP, and there's some very, very promising data coming out about giving PRP as a treatment for diabetic neuropathy. In my case, I actually had a patient who had a post-traumatic neuropathy where she had surgery, and as part of the surgery had lost feeling to her skin. It was a breast prosthetic. She'd received implants, and afterwards she couldn't feel her breast at all. And she came to me actually because the implants had to be removed due to complications, and she had massive scarring, so we thought we'd give it as a cosmetic treatment. But as part of her treatment, that girl has now received full restoration of feeling in her breast, and it's really exciting stuff. I've had other examples of patients with diabetic neuropathy who've had improvement. That improvement is definitely something that needs to be researched more, because it's very hard to know just how good an improvement they've had. They feel there is a subjective improvement, but I haven't been able to get to the bottom of just how good an objective improvement there is there. Finally, we see a lot of stem cells or PRP or other regenerative techniques being used for cosmetics, and it's extremely interesting to watch as patients come in, they get a treatment, they don't know if there's a big effect, and really it is subtle. But if you look at photos from before and after and you give them a 6 or 8 or 10 or 12 month window, you can really see the difference where the patient has had a tightening of the skin, a younger looking skin, and maybe really just gained a little bit of that glow that they've lost. On the other hand, you're not going to see results like you would see with Botox or filler, where you just get this immediate full puffiness that you just can't get it with these regenerative techniques. So there are limitations. There are also limitations in terms of patient results. I've told you a few anecdotes just of some of the results that stand out in my mind, but of course we have other patients who come and they get treated and they do not have the effect they desire, and they're not getting the improvement we'd wish for them. So this is something to bear in mind, but we'll talk about that in other videos when we talk about how to discuss these treatments with your patients. Let me know if you have any questions down in the comments. I look at the comments and I will talk to you again later.